May I call the meeting to order? Roll call?
Mike Baber.
Here.
Chris Brune.
Here.
Lindsay Keisman.
Here.
Amy Raff.
Here.
Greg Alexander.
Here. Public comment? Nada? Okay. Is there anybody, I guess we don't do that anymore, do we? Okay, calling in. Do I hear a motion to approve the minutes of the July 30th meeting?
I'll make a motion to approve the minutes of the July meeting.
I'll second.
Do we need a roll call for that? Okay, all in favor?
Aye.
Aye. None opposed? Minutes are approved. Outcome summary report and graphs.
All right, we'll go to page 4 of the agenda. And so we'll see that for Domain 1, increased knowledge and resiliency, we saw a slight increase in improvement over quarter 2. Abstinence reduction in use, there was a slight decrease from quarters 1 and 2, but still above the network target. Domain 3, for increased level of functioning, there was a noticeable decrease. A few of the court-involved programs saw a significant decrease, so that related to some of those numbers that we were seeing. But if you take a look, the improvement plus the maintaining category in quarters 3, it's looking better than what we saw in quarter 1. So overall, it's not as bad as it looks at first glance. For Domain 4, education, employment and education, there was an increase, and it's well above the network target. For Domain 5, housing stability, there's an increase in improvement over quarter 2. And moving on to page 5 of the agenda, for Domain 6, criminal justice involvement, there's a large improvement over quarter 2. There's only 2 funded programs that report on this outcome, the specialty courts and the McHenry County Sheriff's Office Police Social Work Program. So Domain 7, for social connectedness, there was a noticeable decrease. There was a program that did not run earlier this year, and that was newly factored into that number. And there were several other programs that experienced decreases in that percentage. Moving on to Domain 8, access and capacity. It's typically common for us to see less individuals served in the third quarter of the year. We see this year over year. A couple of programs, we're seeing more increases, especially substance use disorder programs. And we've heard from some of the providers that receive referrals from schools. In that last month of the quarter, they were really seeing an uptick in referrals. For Domain 9, consumer experience surveys, there was a slight increase over quarters 1 and 2 and slightly above the network target. If we move on to the wait list, if you'll scroll down just a little bit, we're seeing that's a decrease in some of the programs and individuals on the waiting list, which is a good thing to, actually, if you'll scroll up some, thank you. So it's good. It's a little bit of a decrease in the number of programs, a nice decrease in the number of people having a wait list, so that's really good to see. Of course, we'd love to see 0, but we'll start little by little. And for the ineligible referrals, we did see an increase in the number of programs and individuals. We tried to combat this by having our providers. We actually, 2 of the 3 most impacted programs did do presentations recently at our intake coordinators meeting. And so that tends to help ineligible referrals coming from our network. However, if they're receiving referrals from out of our county or people who don't attend our intake coordinators meeting, there's only so much we can do to help that. Are there any questions on any of those details? All right.
You mentioned a significant drop in expressed need year over year during third quarter when you were talking about, I think, number 8, but it seems pretty prevalent in a number of areas. Was that a general comment? So it's the total number served. The individual domains 1 through 7, as you remember, we are asking people to report on 2 domains, so we might see duplicate numbers across that. Yeah.
But yeah, typically the summer months, we just see lower volumes in general.
Okay, thanks.
Sure. Any other questions? All right, we can move on to that other page. Thank you, Eric. So on this page, we have a little bit more programmatic information. So OA Out and Connect to Recovery, those are administered by New Directions, and we are seeing significant increase in the number of participants in that program. We're also seeing significant increase for naloxone doses, which are distributed by Live for Lolly. And we also saw a little bit of a decrease, which is really nice to see, decrease in both overdose and suicide deaths, both quarter over quarter and year over year comparisons. Again, that's another number, both of those numbers we love to see at zero, and we appreciate those who are working hard to combat those deaths of despair. We also saw a significant increase in the fiscal year 24 trainings for both the number of trainings that were offered and those attending. So really nice job to our training coordinator and training assistant, Chris and Mariel. They've done a great job really improving those numbers and getting more people trained, which is, again, a nice value to the network because these are free CEU offerings and just helps that professionalism across the board. We did see a slight decrease in the number of QPR trainings and participants. This is administered by NAMI, but as you see, quarters 1 and 2 had pretty substantial numbers, so it's a little bit of an unfair comparison across the quarters. And again, I imagine that there's also less opportunities during the summer months to have these bulk trainings. But I want to point out mental health first aid trainings, which is also administered by NAMI, increased in quarter 3, both in number of trainings and participants. And it's a pretty significant increase when you think about mental health first aid courses are nearly all-day events. So it's really nice to see that many people trained. Any questions on that? All right, we'll move on to the opiate settlement funding outcomes. We have just a few programs that are funded under this funding pool. And so we did see slight improvement in the domain 2, which is abstinence reduction and use, and it is also meeting the network target. I apologize. No, we're above network target. Sorry, my notes were not quite right. Then moving on to domain 8, and this is the number of people who are served, both total number and new. We did see an increase there. Again, that is in line with what we've heard from the network, that those who are providing substance use disorder services, we're seeing an increase in quarter 3. And then for consumer experience surveys, it increased a little bit, still a little below the network target, but not significant enough to cause concern. And we do see no wait list and no ineligible referrals for those programs. Any questions? And we'll move on to the pay for performance, which is our psychiatry programming. Next year it will be called Access Grants. So we're seeing for prescriber capacity and utilization, they both decreased in quarter 3. A lot of that capacity, the utilization has to do with that no-show rate. Capacity is exactly what it is. Are the providers available for the amount of hours that they are hoping to be available for? The no-show rate also increased a bit, but thankfully it is below the network target. Productivity has also slightly decreased, and that is correlated with the prescriber capacity and utilization, so that when we see a decrease in capacity and utilization, we do see that decrease in productivity. The wait time has also decreased, which is always good to see. There was also a noticeable decrease in the number of clients served in quarter 3. Again, it's something we see across the network, so it's nothing of alarm to us. It just tends to happen in those summer months. Also, the average cost per client has decreased, which is good to see, but the cost per hour of service has increased, and again, that's due to that utilization. When there's no shows and the prescriber is available for someone, they still have to pay the prescriber, but they can't capitalize on no-shows, or they can't get reimbursed for no-shows. And the average level of functioning actually had a noticeable decrease. I look back at the individual numbers, and we just have quite a few of our providers that tend to see in the 50, 60, usually the 60% where they're showing the improvement. However, I do want to note that psychiatry has not been reporting on maintaining and improving. We are rolling that out in fiscal year '25. So we will see kind of, it makes sense kind of when you look at the other numbers for our network too, that usually the improvement and maintaining, especially when you're talking about psychiatry, it's expected that once somebody is stabilized, the goal is to make sure that they maintain. And then we did see no change in the client-reported hospitalization and client-reported crisis services. Even though we've seen quarter-over-quarter changes in each individual provider, it just shakes out the same average every single quarter this year. And then the consumer experience survey rating has decreased a little bit in quarter 3. Ineligible referrals also increased in the number of programs, but decreased in the number of individuals. Any questions on those?
So that sums up that agenda item. Thank you, as always, Karen. The next agenda item is the audits, the report on the audits conducted.
Back
There was
to
a
me.
spreadsheet that went out.
Yes. So all of you have received the full audit report, so I will stick mainly to the recommendation portions, and I'll go about 3 at a time, and if you feel free to stop me if you have any questions or comments. So we'll start with Horizons Behavioral Health. There were really no recommended or required actions at this time. Moving on to Independence Health and Therapy. We noticed that there was a little bit of challenge with some of the notes that weren't in their new electronic health record system. However, at a subsequent meeting, we were able to meet with Independence Health and Therapy, and they were able to show us the paper versions of those notes. So it's really just a matter of them having time to get fully incorporated into their electronic health record system. Northwestern Medicine really had no recommended actions other than when they received the Joint Commission reaccreditation determination to just send that our way. And we had the same thing with Aunt Martha's, just that requirement to send their recertification to us. Greater Family Health, we didn't have any major findings or any challenges with the audit review. We did ask them to reevaluate what they're doing for MAT outcome metrics and to report back to us on a reasonable way for them to incorporate that into their reporting to the Mental Health Board. WorkCorps, we had good discussions about data reporting and what's expected and what counts as a reportable service to the Mental Health Board. In our discussions, one of the recommendations we have is that their staff participates in both mandated reporter and HIPAA training. Any questions on any of the audits so far? Okay, moving on to NISRA. Again, no required or recommended actions. It was a very good audit. No findings from our evaluation. Northern Illinois Recovery Center. They have finally launched their SAP program, and when we visited them earlier in the year, they had not had any client data for that program at that time. However, they've now worked with clients, and so we'd come to find that they hadn't developed a release of information for that program yet, so that is one of our required recommendations for them, is to develop that release of information. And again, some more of the data reporting, that they use a client ID for that program to make sure that we're not receiving client initials. And then we did have recoupment for them, and it was really because they, in order to utilize their SAP staff more effectively during the slower months, they had them participate in the fee-for-service program. But for the Mental Health Board, we don't allow reimbursement under 2 different programs. So their SAP program, they are 1.0 full-time equivalents. So in our eyes, they are fully funded under that program. If they report them under the fee-for-service program, that's kind of considered double dipping. So we have required recoupment of $426.80 for that program. Any questions so far? Veterans Path to Hope. We had some discussions about releases of information. There was a couple that didn't quite meet the standards that we're asking for, and just reminding them about best practices of releases of information. So we don't have any required actions that they have to do, but more of that consultation piece that you see written in the result of the audit. For NAMI, we also visited NAMI. We had some conversations about service note documentation, and then we made a recommendation for them to consider implementing a deadline for service notes to make sure that they're in a timely fashion and supervisors can review things accordingly, so that they're not pressed when they're ready to submit to us to make sure everything is in there. And there's a little bit of release of information challenges too, which just tends to be the nature of what we see across our network. We also saw Service Inc. They actually had a really good audit. They really worked hard to implement all of the requirements that we've requested, and it was evident in their audit. We met with Rose Grants. Again, very slight data reporting issues were related to date of birth reporting. So again, we asked that they just keep a close eye on their reporting to the Mental Health Board. And that's really it. We conducted 34 audits for a total of 84 work plans this fiscal year.
Any questions for Karen? It's a lot of work. So, and important work, thank you. Did you want to comment back, I should have asked this, the outcome summary, there was some additional information about the waitlist detail. Is there anything that we should have?
You know,
No,
and
it's just for
Sure.
information, for clarity.
yeah,
Okay,
yeah, just for information. I know at the previous meeting it was discussed about, can we look at where we can assist providers in reducing their wait list? And from the individual review, a lot of those details are related to staff vacancies, staff turnover, or bed availability.
Right.
So I'd love to say, oh, we've seen a current theme that we know we can solve this problem with providing additional funding, but they're really outside of capital and outside of behavioral health retention. There wasn't any theme that I could offer.
Just so we're on the agenda, we'll call that old business discussion. Yeah, because it is kind of a carryover from what we talked about last time. Okay. Any other old business? Do I have the power? No, he has. Person in, Amy's in queue.
Thank you. Thank you for all of the work and for making it so clear, and thank you. It's incredible. This is a general question. Do the providers get any bragging rights from us for having good audits? Like, you know, I'm a 4-star provider or anything like that, just to show off? I mean, I feel like obviously these are all things they have to do anyway, but given all of the work that you've talked about and how some people on top of their normal jobs have to do all of this on top of it, I'm just wondering if there's anything that we give them to pat on the head.
It's a good question. You know, usually it's at least acknowledging it in the audit report to the best of our ability, but beyond that, I can tell you, if individuals, we tend to see providers more often than just once a year. If they're a new provider, if they've had some challenges in their audits, we might see them 2 or 3 times a year. I would say a big bragging right was probably that they don't have to see us again that fiscal year. We'll usually make that determination that they've done well, they've accomplished what we've asked, and we can give them a little bit of breathing room.
That's an interesting question. Yeah. Any other questions or old business for discussion? Then we'll move on to new business. The NAMI written plan for Kaizen access handout.
So I'll preface this with, the Mental Health Board will get, will sometimes get emails or calls or anonymous and even non-anonymous entries from our website. So we do receive feedback from the community, from other providers, from consumers about some of the challenges they are seeing with our providers, and so we do investigate. In this instance, we did have an anonymous complaint that was alleged against NAMI this past summer, and so due to the information that was provided in that complaint, we did launch an investigation. I do want to commend NAMI. They were very cooperative in that investigation. And then we ended up meeting with NAMI to go over the results of our investigation. So our board president, our Ethics and Compliance Committee chair, our executive director met with NAMI's board chair and NAMI's executive director to discuss the findings of our investigation as well as the requirements that the Mental Health Board had put forth in response to what we evaluated. And so we looked at a few different areas. Some of it was operational in nature, and so we just had some discussion and consultation about some best practices, and NAMI had already implemented quite a few things prior to us even meeting. The biggest component of this was the Kaizen Ride allegation. So Kaizen Ride service platform, the Mental Health Board allows certain providers to utilize this service for clients to get to and from treatment or prevention recovery support services. We do have restrictions that it is supposed to be for just that, and it's not supposed to, it should not be a continual requirement, that it should be a last resort. And so we did evaluate the Kaizen Ride information for NAMI and found a couple of things that didn't meet our criteria for what we were expecting. We asked NAMI to further evaluate and to provide payback for the amount that they felt did not meet that criteria. We also required NAMI to not have access for the Kaizen Ride platform for the remainder of fiscal year '24, and that if they would like to utilize Kaizen in fiscal year '25, that they provide us with a written plan to advise on how they will make sure that it's used according to our parameters. So in front of you, you'll see the letter that NAMI has provided regarding what they evaluated and what they are paying back. And then you'll also find the plan of what they will do to ensure that it is used as intended in fiscal year '25.
I want to echo that NAMI was very cooperative and timely in getting it resolved, so. Any questions for those of us who were there? So, any more on that, Karen? Or,
No, that's all I have.
okay, so I think we're,
So I just wanted to add, at this point, the recommendation is that, they're in compliance with the plan and that they'll be that Kaizen will be a platform again that NAMI will be able to use in fiscal year '25.
yeah, there's sort of a, I don't know if it's the right word, this probationary period during this fiscal year to get things in order so that it can reinstate, so. Do I hear a motion to adjourn?
Motion to adjourn?
We don't have member comment on the agenda, so. Second. All in favor? All opposed can hang around? Okay.